tough story. You know, you talk to the mothers and you say, I don't even know how they get up in the morning. And you know, Hank and I were talking earlier about, you see the mothers that come in the beginning of the family action plan, and then you talk to a mother who's graduating, and the difference is, it's life change. It's a life change. And you know, they come in and they don't have an identity number, and they have a husband who's beating them, they have legal problems, and a sick child, and the place they live is horrible, they don't have a job. And they come out and they're standing on their own 2 feet, and there's a checklist, right? There's, the house is appropriate, they have a job, the kids are in school, their legal issues have been taken care of, and that process.
Education and health has to be okay.
Yeah.
In order to be released from the program.
But then they're on their own. You know, they have a business, they have a job, they have a salary, the child's health is stable, if not cured. And, you know, like you said, this didn't happen overnight. But, you know, now when I think about it, I've been here, you know, for 3 weeks with you, it's so obvious to me. And you know, all the difficulty of getting there, but this really is a roadmap that anybody can follow. If there's volunteers and a committed person and the community working with the social issues in the community, this family action plan is something that anybody can really implement, right?
And just to explain more about the family action plan, because it's the DNA of our methodology, is because when a family comes, you know, the mother, usually the mother, they come, they build the family action plan. They say what is, for example, the social worker or the volunteer asks, how do you think about your life 2 years from now? What are your main problems? So sometimes it's housing project, you have to have a more house with more dignity. Sometimes it's job training, but many times it's a lot of things together. And we have to plan actions, you know, action plan for each, you know, goal that we have to reach.
And it can't be overwhelming for the mother either, right?
Because they have a very hard life. So because it's a two-way road, the social worker is so committed, heart with the other person. She wants really to address the problem. And she wants, in the same time, it's not something assistencialismo we say in Portuguese, you know, that you give everything.
No, it's not assistance.
It's not assistance. You know, the mother, she knows that she has,
in order to take ownership.
In order to receive, you know, for example, the right to go up to a private school, to the house to be reformed, she has to go to job training, as she, you know, asked for, because we didn't decide what type of job training, so she decided. And every month she passed to many services like legal support, psychological support, food distribution, because they don't have money in the beginning to buy the food to survive, you know, health care, because we are linked to the hospital.
And probably initially they may not even value or say they need the psychological or legal support, right? But we know.
We know.
So we make that part of the program.
In some ways, because they have experience with the other models that are in the program, they learn from them how much they can, you know, use the program to benefit their lives. So during those 21 years, it's so fantastic to listen. In the end of 2 years, you saw one person in the beginning, as you said. She was so depressed, and sometimes the whole staff and the volunteers say, oh my God, that mother will not be okay, never, because a lot of problems, she's HIV positive, 2 children with HIV, you know, no husband, no house. But then 8 months later, you start to appear a new woman from that person, you know. And the good thing, it was not magic things, it was something that you address, that is not only, you know, goods that you give to her, a better house, you know, job training. It's something that you really share with the other woman.
There's hope, and you know, they get hope, and the support structure that they're not alone in it either, right?
Because normally the miserable people, they live surrounded by miserable people, so
there's no way out.
No way out.
So
when they come here, they start to have another type of family.
They see other mothers that are coming out,
and people that really trust them, you know.
Yeah.
Because one the
And believe it.
and it is cheap because it costs around $400 per month per family, and it takes 2 years. And I think, my goodness, if I was
like $10,000 saves a family, not a life, a family.
a family.
And the woman we met, she's now employing her 2 sisters in her hairdresser shop. So, you know, the Family Action Plan is lifting 3 families' lives out of misery, you know.
So, when I had to speak very fast, what Saude Crianca is to transform miserable people in poor, and we know how to do that, and that is the worst problem in the world, you know.
Yeah.
There's nothing worse than that.
And the amazing thing is, that action plan, that step-by-step engagement, solves it, 1 person at a time. It solves it. It pulls them out of that misery permanently. You know, there's assistance to standing on their feet. So the hospital bed stays goes down 60%.
So
the income up 40+%.
Yeah. So we serve the government, the public, with private money and with the help of the civil society.
Yeah.
So all part of the society, government, private companies, and civil society are in our DNA.
Yeah. And that's a big part of the whole social inclusion model. It's not one entity's role to bring our society together in a way where everybody can lead with dignity. It's everybody's role, right?
Is everybody?